As we gracefully age past 60, a time of reflection and continued growth, it's natural to prioritize certain aspects of our well-being. We often hear about the importance of cardiovascular health and cognitive function, and rightly so. We often focus on our heart and memory, diligently monitoring our blood pressure and engaging in activities that sharpen our minds. These are vital components of healthy aging, no doubt. But how often do we think about our bones, the silent, yet essential foundation of our daily lives? They are the framework upon which our bodies move and function. They let us walk, allowing us to explore the world around us, to stay active and engaged. Hug loved ones, providing the physical connection that strengthens bonds and brings joy. And stay independent, enabling us to maintain our autonomy and live life on our own terms. Yet we often ignore them until problems arise, until a fall or a fracture forces us to confront their fragility. We take them for granted, these unsung heroes of our physical existence. Today, let's commit to giving our bones the care they deserve, to proactively nurturing their strength and resilience. Let's shift our perspective from reactive to proactive, from neglect to nourishment. Bones aren't static. They are not simply inert structures that hold us up. They're living tissue, constantly renewing themselves, undergoing a continuous process of breakdown and rebuilding. This dynamic process is essential for maintaining bone density and strength. But as we get older, bone loss can outpace bone creation, the balance shifts, and our bones can become more porous and brittle, leading to osteoporosis, a condition characterized by weakened bones and an increased risk of fractures. Osteoporosis isn't inevitable. It's not a foregone conclusion that you will develop this condition as you age. You have the power to protect your bones, to take control of your bone health, and mitigate the risk of fractures. This guide will help you understand osteoporosis, providing you with the knowledge you need to make informed decisions about your bone health. Recognize the signs, helping you identify potential problems early on and seek timely medical attention, and take practical steps to strengthen your bones, empowering you to build a stronger, healthier future. We'll cover the best foods, rich in calcium and vitamin D, essential nutrients for bone health, exercises, including weight-bearing and muscle-strengthening activities that stimulate bone growth, and conversations to have with your doctor, ensuring you receive personalized advice and appropriate medical care. The goal isn't fear, but empowerment. It's not about dwelling on the potential risks, but about taking control and building a stronger future. No matter your age, it's never too late to make a difference. Even small changes can have a significant impact on your bone health. Every positive choice you make today builds a stronger tomorrow, contributing to a more resilient and vibrant you. With the right habits, you can improve your strength, enhancing your ability to perform daily activities with ease. Balance, reducing your risk of falls and maintaining your independence. And reduce fracture risk, allowing you to live a more active and fulfilling life. Let's start this journey to a future where you stand tall and live life to the fullest, with strong bones supporting you every step of the way. Osteoporosis. The very word itself hints at the condition's nature. It means porous bone, a term that perfectly captures the essence of what happens to our skeletal structure as this disease progresses. Healthy bone, when examined closely, looks like a dense and well-organized honeycomb. It's a strong, resilient structure designed to withstand the stresses of daily life. This intricate architecture is only visible under a microscope, revealing the complex network of mineral deposits and living cells that make up our bones. Osteoporotic bone, in stark contrast, has larger and more numerous holes. These gaps weaken the internal framework, diminishing its ability to bear weight and resist impact. This increased porosity makes it fragile and prone to breaks. The bones become brittle, losing the density and resilience they once possessed. As a result, fractures can occur even from minor bumps, simple falls, or even something as ordinary as a sneeze. The slightest stress can compromise the weakened bone structure. It's a silent condition, often developing without any noticeable warning signs. This is why it's so important to be proactive about bone health. In many cases, it shows no symptoms until a fracture occurs, often unexpectedly. This first fracture can be a painful and alarming introduction to the reality of osteoporosis. Bone loss happens gradually over many years, making it difficult to detect without specific testing. It's a slow and insidious process. This occurs as bone breakdown or resorption outpaces bone formation. The natural remodeling process of bone becomes unbalanced. Think of your bones like a bank account. where you're constantly making deposits and withdrawals. During youth, you deposit bone tissue, building a strong foundation for the future. This is the time to invest in your bone health. But after age 30, withdrawals start to exceed deposits, and this is a natural part of aging. However, with osteoporosis, this process is accelerated. For women, bone loss accelerates significantly after menopause due to the decline in estrogen levels. This hormonal shift can have a dramatic impact on bone density. For men, the process is more gradual, but bone loss still occurs with age. Maintaining bone health is crucial for both genders as they get older. It's important to remember that osteoporosis is not the same as osteoarthritis. They are distinct conditions with different underlying causes. One affects the density and strength of bones, while the other affects the joints, causing pain and stiffness. Knowing the difference between these conditions helps you seek the right care and treatment for your specific needs. After 60, fractures caused by osteoporosis can be life-altering events, significantly impacting quality of life. These fractures can lead to a loss of independence, chronic pain, and a decreased ability to perform daily activities. Hip, spine, and wrist fractures are particularly common and can have serious consequences. These types of fractures are especially serious, often requiring extensive medical intervention and rehabilitation. Understanding osteoporosis, its causes, and its risk factors is the first and most important step towards prevention. The good news is that it's a treatable condition, and there are many things you can do to protect your bones. Your actions matter, and the choices you make today can have a significant impact on your bone health in the future. By learning about osteoporosis and taking steps to prevent it, you're already actively protecting your future mobility and overall well-being. So let's take the next step together and explore what you can do to keep your bones strong and healthy for years to come. Why do bones weaken with age? It's a mix of hormonal changes, nutrient absorption, and lifestyle. For women, the drop in estrogen after menopause speeds up bone loss. Men lose bone more slowly, but declining testosterone also plays a role. Aging bodies absorb less calcium and vitamin D, making bone maintenance harder. Less physical activity means fewer signals to keep bones strong. Certain medications and health conditions can also increase bone loss. It's the combination of these factors that makes osteoporosis more common as we age. Some osteoporosis risks, like age, gender, and genetics, can't be changed. Women, especially postmenopausal and those with a family history, are at higher risk. But many risk factors are in your controlled diet, activity, alcohol, and tobacco use. Low calcium and vitamin D intake, excessive alcohol, and smoking all weaken bones. Sedentary lifestyles are a major risk. Regular movement is key. Even small increases in activity help. Certain medical conditions and medications also raise risk. If you have these, be extra proactive about bone health. Knowing your risks lets you take action to protect your bones. Osteoporosis is called a silent disease because early bone loss has no symptoms. Watch for subtle signs: losing more than an inch of height, a stooped posture, or sudden back pain without injury. These can signal tiny spinal fractures. Fragility fractures, breaks from minor falls, are a major warning sign. Hips, spine, and wrists are most at risk. If you notice these signs, talk to your doctor right away. Early detection can prevent more serious fractures. Don't ignore the quiet signals your body sends. Strong bones need the right nutrients. It's not just about avoiding fractures, it's about maintaining an active and fulfilling life. Think of your bones as the scaffolding that supports everything you do, from walking and gardening to playing with grandchildren. And when it comes to bone health, two nutrients stand out, especially calcium and vitamin D. These two work in synergy to keep your bones strong and resilient. Calcium is the building block, while vitamin D is the key that unlocks its absorption. Adults over 60 need about 1,200 milligrams of calcium daily. This is a crucial intake to offset the natural bone loss that occurs with age. Pay close attention to nutrition labels and make informed choices about the foods you consume. Dairy products are excellent sources, as are fortified plant milks, offering a great alternative for those who are lactose intolerant or prefer plant-based options. Look for varieties that are specifically fortified with calcium and vitamin D. Don't forget leafy greens or fish with bones like canned salmon and sardines. These often overlooked options are packed with calcium and other essential nutrients. Vitamin D helps your body absorb calcium. It's the enabler that ensures your body can effectively use the calcium you consume. You can get it from sunlight. Even just a few minutes a day can make a difference. Fatty fish, fortified foods, or supplements. Most older adults need a vitamin D supplement. Ask your doctor for the right dose. They can assess your individual needs and recommend the appropriate amount. Protein is also vital for bone structure. It acts as the framework upon which minerals like calcium are deposited. So, include lean meats, fish, beans, and nuts in your diet. Magnesium from nuts and seeds, whole grains, and vitamin K from leafy greens support bone health. These micronutrients play a crucial role in bone metabolism and density. A balanced whole food diet is your best strategy. It ensures you're getting a wide range of nutrients that work together to support your bones. There's no magic pill. Relying solely on supplements isn't the answer. Consistency is key. Small, regular changes to your diet are far more effective than sporadic attempts at healthy eating. Good nutrition builds a strong foundation for your bones, providing the essential building blocks they need to stay strong and healthy. Make small, sustainable changes for lasting results. Focus on adding nutrient-rich foods to your diet rather than restricting yourself. Every meal is a chance to support your skeleton. Think of each bite as an investment in your long-term health and well-being. Pair nutrition with exercise for the best results. Weight-bearing exercises in particular can help to strengthen your bones and reduce your risk of fractures. Your bones will thank you, allowing you to live a more active, independent, and fulfilling life. Exercise tells your body to build stronger bones. Weight-bearing activities like brisk walking, dancing, and stair climbing are excellent choices. Aim for at least 30 minutes most days. Resistance training, using hand weights, resistance bands, or body weight, builds muscle and bone. Strong muscles improve balance and reduce fall risk. Do strength exercises 2-3 times a week. Balance and flexibility exercises, like Tai Chi or gentle yoga, help prevent falls and improve posture. Good posture reduces stress on your spine. Start slow and progress safely. Always check with your doctor before starting a new routine, especially if you have osteoporosis. Consistency matters more than intensity. Find activities you enjoy to stay motivated. Movement is medicine for your bones. Your doctor is your partner in bone health. Start the conversation. Bring up your risk factors, diet, exercise, and medications at your next checkup. Ask about a DEXA scan to measure bone density. It's quick and painless. Results show if your bones are healthy, low in mass, or osteoporotic. Your doctor will recommend prevention or treatment based on your results. Medications, nutrition, and exercise may all play a role. Don't hesitate to ask questions or request referrals to specialists. This is a team effort. Your commitment and your doctor's expertise work together. Proactive conversations lead to stronger bones and a healthier future. No matter your age, you can improve your bone health. Small, consistent actions like daily walks or adding calcium-rich foods make a big difference. Practice balance exercises, like standing on one foot, to boost stability. Each healthy habit is an investment in your future independence. Don't aim for perfection, just progress. Listen to your body, nourish it, and keep moving. Bone health isn't just about preventing fractures, it's about living fully and confidently. Celebrate every step forward. You're building a foundation for an active, joyful life. Stand tall and feel your strength. Your future is supported by the choices you make today. Take the first step now. Your bones will thank you. You have the power to build a stronger you starting today.